All right, so what we're gonna do is foam roll the quads with foam roller. I don't care which foam roller you use. You know, this one's really great. This is, I think the Gator Teeth. You know, it has some nice kind of tough ridges that really get in deep. The idea though is, you know, the quads are kind of a big muscle group. So we're gonna really put dedicated work by, you know, breaking it into thirds. So we have top third, middle third, and then lower third. So the idea is we're going to work one zone really well before we move on to the next zone, making sure that we clean everything up. So top zone, we're also accounting for, you know, the angle of our pelvis. So, you know, instead of setting up neutral, we're going to kind of tilt that foam roller just a little bit on our setup. So here's your ASIS, that's your landmark. For your hip flexor, you're gonna come just underneath that and you're gonna anchor the foam roller there. So the first thing that I'm gonna do is I'm just gonna see if I can actually like tolerate breathing on this. If I can breathe into it and it didn't have a whole lot of pain, then guess what? I can be more aggressive with it. Now, what I'll start to do next is I'll start to shake and shimmy, scrubbing the tissue out. And so I'm gonna scrub it out for about 30 seconds. You know, while I'm scrubbing, I'm looking, scanning, seeing if anything's really catching my attention. You know, I can start to change the angle of my hip to catch more of the outside fibers. I can also change the angle of my hip to catch a little bit more of the inside, more of the adductors. But the idea is, you know, we move in 3D space, so stress occurs more than just front to back or side to side. So now that I've scrubbed it out for 30 seconds, you can go up to a minute. What I can do is I can start to contract and relax into the foam roller. So basically I'm thinking about extending my knee and pushing into the foam roller, pushing into the foam roller. And so I'll do like 3 or 4 of these just to kind of get deeper onto the foam roller. Now I'm going to start to roll top to bottom, and I'm staying right here in this first zone, really just staying in this first zone, not getting overly aggressive. But what I am going to do is I'm going to shift the angle of my hips so that I'm catching some of the outside fibers and I'm catching some of the inside fibers. And so if I find something interesting, I'm going to basically make sure that I spend some good quality time there cleaning it up. After I do this, I can start to get a little bit of a pull with my knee. And so basically I'm just bringing my foot to my butt. Now I can change the angle outside of my hip. I can change to reach towards the other hip. But the idea is my knee is just allowing that muscle to pull underneath my contact. Now, you can do the same thing by rotating your hip and pelvis and getting some active range of motion if you want to. It just depends on what you want to do. So now that we've cleaned up first zone, we're going to rotate forward and we're going to basically set up on the second zone. I'm going to restart that process all over again. I'm going to sit here, take a deep breath. If you can breathe into it, you can be more aggressive. You're going to start to shake and shimmy just to scrub it out. See if there's anything interesting worth your attention. You can change the angle, catch more of the inside fibers. You can change the angle, catch more of the outside fibers while you scrub it out. Once you're done scrubbing, you can do the contraction. So you're basically thinking about pushing that foam roller into the ground and relax. Straighten out your knee and relax. Push and relax. So you can do that 3 or 4 times. At this point, you can start to roll up and down. So we're right here in the second zone, doing nice dedicated work. Rolling out, rolling out. While I'm rolling out, I'm changing the angle of my hip and pelvis. Catch more of the inside fibers. Changing the angle of my hip and pelvis. Catch more of the outside fibers. So it's just kind of what, you know, what's your body telling you that you need to focus on. And then I'll finish off with a little bit of that, knee action. So basically I'm bringing my foot to my butt. I'm rotating outside of my hip. I'm bringing my foot to the other side of my hip. So you can do this also while you're changing your rotation or your angle of your pelvis. So, the last third is really, just clean up. Your tissues start to converge around your patella, so there's basically a tendon. I'm not really worried about any tendon stuff going on. Most of the work was done in first, second zone. This little last zone is really just clean up. You'll probably find inside of your knee starts to converge with a little bit of those adductors, so that's probably going to be grumpy, but the idea is we're still going to just give dedicated work to that third zone.